So all of these contributed to our, these were fundamentally public health research, which contributed towards stopping the pandemic to some extent, or stopping the negative impact of the pandemic, and it helped us to develop our health policy. So ultimately, we valued research during the pandemic and followed the science, which helped us in coming out of the pandemic to some extent. So, of course, the next issue is about the relevant area. Who will benefit from your research? So, it is particularly important that the research is available or is important for the local population, because in the population particularly in which you are going to conduct the research, and the facts should be trustworthy. So this is one very important aspect, especially in biomedical sciences and public health, is that the research should be trustworthy. That is why it has become so important nowadays, especially in international journals. We have to submit our data to them, our raw data sets to them, because to ensure the trustworthiness of our data. It is not that you just haphazardly take a few people and collect some data which might not be generalizable, which might not be trustworthy. So conducting trustworthy research is particularly important, and for any organization, for any individual, and this kind of trustworthy research is what can actually improve our research standards for the country as a whole. And once you generate some research ideas and you want to say, suppose you find out that exercise is useful for a certain health condition, but you have to see that the change you are recommending to the community, it should be acceptable, it should be available, it should be affordable, it should be accessible. So a lot of qualitative research aspects are required here, where we identify what are the barriers, what are the facilitators in adoption of any kind of, say, evidence which has been generated from the research. It is not simply that you come to know. Awareness is not enough. There is, for the population to internalize your findings, it is particularly important that you understand what are the barriers and facilitators in acceptability, availability, affordability, and accessibility of the healthcare recommendations. So there are various types of research. I've spoken primarily about public health research here, but there is basic research, there is clinical research. Most of you are familiar with clinical research which is predominantly connected among patients in hospitals, or patients in controlled settings, while public health research is research which is mostly conducted in communities, or it is the translation of research conducted in clinical settings into the community settings. Basic research is more structural, like development of drugs, development of vaccines. These are more purely laboratory-based research. So, and often they involve very few human participants. So usually the phase 1 clinical trials, phase 0 clinical trials, these will come in the basic research, while clinical research will involve all the phase 2, the phase 3 of the clinical trials. Public health research, of course, involves a lot of different kind of research. As I told you, it could be something just it could be a simple observational study, or it could be some experimental studies. It could be certain pragmatic trials, which we can, or community-based interventions. But the thrust is on improving the health of the population as a whole. So your basic level, you're in clinical research, while you're focusing on individuals. In public health research, your health unit is the community or a household, for instance. Okay. So we look forward to invention, which happens in your basic research, like you invent a drug, you test that drug in your clinical research, phase 3 trials, placebo-controlled phase 3 trials. I think these terms are now fairly commonplace after COVID, because we had so many vaccines, so many phase 3 trials, and now even phase 4 trials. And next is, once you have these vaccines, our challenge was, a major challenge was, we had the vaccine, but there was so much vaccine hesitancy, for instance. People were unwilling to take the vaccine because there were a lot of myths and misconceptions. So implementation, how we succeeded in vaccinating nearly now it's over 200 crore doses we have provided to our population. So how did we succeed? How did we dispel vaccine hesitancy? Because initially there was so much vaccine hesitancy during the COVID period. So this is all the magic of implementation, and all this within the community comes in public health research. So this is from the perspective of COVID-19. You can see that basic scientists were doing genome sequencing, for instance, and these were to discover, like, we had the Delta variant, now we are looking at the Omicron and even sub-Omicron variants. So identifying which variant is happening, for that you need genome sequencing, which basic scientists were doing, like biochemists, biochemistry specialists, pathologists, microbiologists. These were working in this field. Then you had epidemiologists who do outbreak investigation and trends. Like I was involved in many serosurveillance, for instance. The serosurveillance was one aspect where epidemiologists were involved. Biotechnologists had a very major role because they were developing all those wonderful test kits. Because when we started, we had just a capacity of 10,000 testing capacity when in April of 2020. Today, we have almost 100 times higher testing capacity. So how did we achieve that? That could only be achieved with developing very kits which were very accurate, affordable, and work fast. So our RT-PCR capacity, our rapid diagnostic capacity, antigen-based tests, all of them were developed in very short time, like mass vaccine production. So it was not enough to just develop the adenovirus-based vaccines. It was also we needed mass production, and which happened. And India finally was self-sufficient in vaccines. We did not have to depend on other countries for our vaccine requirements. And this could only be achieved through breakthroughs in biotechnology. Then prevention. So prevention would involve, of course, the vaccine development, but also public health scientists, public health managers. As I told you, we had to plan all our vaccine sessions. How do you vaccinate such a whole population in such a short period? How do you overcome vaccine hesitancy? How do you track adverse effects following immunization? Because there were many PILs there were many lawyers, there were many PILs in our judicial system which were asking that how many adverse effects are happening, how many people are dying or from the vaccine. It was a very low level. It happened in a very small, minuscule population. It was not significant at all. But still, the data had to be collected. That was the AEFI data was collected very meticulously. There were a lot of meetings, special groups were constituted, and all this comes under the public health. Right? There are behavioral scientists who are developing those very key, catchy messages. So initially, you had messages for maintaining social distancing, hand washing, everything. But later, what we were doing, we were also developing very important messages for improving vaccine acceptability, for improving vaccine acceptance. And because remember, India did not have a compulsory vaccine mandate like say Australia, where a tennis player was sent home because he was not vaccinated. We did not have such stringent mandates. It was vaccination in India was voluntary, but despite it being voluntary, we were able to vaccinate almost more than 80-90% of our population has received at least one dose of vaccine. So that is a very good achievement we were able to do, and that happens again through behavior. What you probably understand from behavior change communication, that comes under the behavioral scientist work in public health. In treatment, we had a lot of trials with repurposed medications. Not all of them were successful, but still we did a lot of trials. Then there were public health managers, like we had to have many kinds of isolations during the Delta wave, particularly when we were running out of beds and oxygen. We needed public health managers to implement, to set up new hospitals, to set up temporary hospitals, to set up isolation camps, to set up isolation centers. So all of this happened through public health managers. Post-COVID rehabilitation, because now even post-COVID, we have seen that there is a lot of problem. A lot of people have respiratory difficulties. There are certain kind of side effects. There are certain kind of long lingering problems, especially respiratory, mental health problems. So all of these rehabilitation for post-COVID can only happen when you have a clear-cut strategy. So most of the governments have some strategy, but in this rehabilitation process, public health experts have a major role to play. And of course, improving patient care. Although directly public health people don't, it is the forte of clinicians in improving patient care. But definitely in some of the research activities, public health specialists were involved. For instance, one of our papers from the PHFI was on the risk factors at admission, which could which could predict the survival of a patient. So the risk factors, these risks, it was published in PLOS One. So again, it was a data. This data was collected from hospitals across the country, and it was finally analyzed and authored by as the first author by one of the PHFI faculty. So this is again how public health is in every aspect of research during COVID-19. But what is the problem with our research capacity? It is this figure basically is showing that how much shortfall we have compared to our requirements. So, and the shortfall in research it also correlates with our health indicators. India's health indicators are still behind other developing world countries. So we still have a lot of catching up to do. So we are progressing, but this progress is uneven across sectors. So what we have done, these are various, since I have a very knowledgeable audience, so I will not go into the programs which the government is running. We have Ayushman Bharat, Swachh Bharat and others. We are setting up clinical trial units across the country. We are recognizing evidence-based decision-making. The funding from Indian organizations, the government organizations like the ICMR has increased substantially in the last 2-3 years. And we are producing more number of doctors, nurses, pharmacists, dentists than ever before. But we still need to improve the skilling of these resources, and we still are very much behind when it comes to research output and skilled public health resources. So if you see our public health requirements in India, there is quite a bit of shortfall you can see. So based on this, the shortfall in the public health professionals, there is a considerable gap. And so if we look at from the aspirational scenario, there is a lot of gap which is happening. This research was also carried out in PHFI, recent and published in 2019. So what avenues do you have? So finally coming to it, I just discussed briefly with you why you should probably go in for public health. It is not about going for public health with IIPH or PHFI generally. So as a see, I was a medical graduate, so I had a very straightforward path towards public health. If you work, when I did my post graduation in community medicine, I knew that of course I could either work with an academic institution as a faculty, or I could just venture towards some other path. So today, where I'm working, I'm getting the opportunity of both teaching. I teach master in public health students. I teach MSc students, and I also am involved in a lot of research activities across the country. So that is so for MD students, I feel, but so for MBBS students, of course, one easy avenue if you want to work in public health is to community medicine provides that opportunity. And of course, after that, you still, after 3 years of this, you still have to decide whether you want to go into academia, like doing a senior residency. I also did a senior residency afterwards, but that's different. But whether you want to do SR shape, go into a faculty, or you want to venture into public health. If you want to venture into public health, there are a lot of private organizations, there are government organizations. You can work with the government directly in implementation, or you can go towards certain organizations which are mostly involved in research. And this research is conducted with a lot of multinational organizations like the Bill and Melinda Gates Foundation, UNICEF, World Health Organization. So those opportunities are there. However, what about people from, say, the dental background? So if in our MPH course, we have, which I'm going to discuss with you, we have around 50 students currently in every batch, and almost more than a majority are from the dental background. So then, this is, of course, if someone wants to go into the clinical side of dental health, then obviously that's different. But MPH provides an opportunity, and MPH is a very multidisciplinary field. I will say, like public health is multidisciplinary. Like we have faculty not only from community medicine, like I'm, but we have faculty from economics. We have faculty in various other from physiotherapy. We have physiotherapy background who then later did their MPH, then went on to do their PhDs, and now they are working with us. So we have a lot of skill. We have faculty from nutrition background. So the main crux is that public health is a multidisciplinary, interdisciplinary field, and it will always be have requirements for people from various various disciplines. So there is a lot of diversity in our field, and that has to be respected, of course, because it is not just the work of doctors or paramedical staff alone. So as I told you, in our program, we have students from sociology, political science, nursing, but a majority are dental graduates because the FPH course is quite popular among dental professionals. So again, it depends. If someone wants to work in public health in the life sciences, and you already have a undergraduate program which is involved in health, so there MPH also provides you opportunity, but it also provides opportunities for those who may have had a background in a non-health scenario but now want to contribute towards the life sciences or improve the health of the population. So these are some of the courses which we are running. So ACSIR is the Academy of Scientific and Innovative Research. This is a university which was formed by an act of parliament in 2011, and these programs are offered jointly. So we have a 2 years program in MPH. Last date to apply has been extended till 30th June if someone is interested, and you can look at our website for further details. So our MPH program is now running since 2014. So we have had 7 batches, and we usually have between, I will say, 50 to 60 students per batch. We have a 1 year course also in postgraduate diploma in public health management. This course is also full-time, face-to-face full-time course. Okay, and this diploma course has a consortium across 10 sites. So all of these sites have teach the same program. So there are some government ones also, like the All India Institute of Health and Public Hygiene. NIHFW is also running this course. So this has now expanded to 10 sites. So all of them have the same curriculum, the same guidelines. Then we have an integrated MSc and PhD in clinical research. This program is on clinical research program, and this is again a 2 year program, but it has an opportunity to do a PhD also. It has some requirements. So someone with qualification in the life sciences is eligible to apply for our MSc, but our MPH is very liberal. We take people from all backgrounds, but our MSc course is more specialized. We have had around 10 students, and this course is running for, we have 10 students for every year, and this is running since the last 4 to 5 years. And so you can see that this clinical research is particularly important, I would say, because this is one of the only programs in the country which is a 2 year full-time clinical research program, and which provides opportunities to develop and hone your skills in doing and conducting clinical trials, medical writing, pharmacovigilance. So this is quite a unique type of program, I would say, the clinical research program, and which has quite a huge potential considering the number of clinical trials we are going to be conducting in our country over the years and the lack of skilled human resources for it. So our program is competency driven. We have linkages with public health practice. There's a lot of emphasis on problem solving, innovative pedagogical methods we are using. We have a learning management system, a virtual classroom experience, and self-paced learning. We have multidisciplinary, as I told you, we have students from various undergraduate backgrounds. So that can vary from the life sciences, pharmacy, nursing, dentistry, biotechnology, even some medical graduates. Particularly, it's mostly in-service candidates when it comes to MBBS. But we have had from other branches, there are a lot of students, a lot of Ayurvedic, homeopathic, people with bachelors in statistics. So what are the career opportunities? So many of if you look at the career opportunities, we our students have been placed in medical device companies, in pharmaceutical industries, biotechnology companies, with auditing of clinical trials, the regulation of clinical trials, medical writing, research sites, and many more. Our job roles. So this is mainly for the clinical research. I'm telling you. So if so in quality assurance, research site manager, drug safety. Initially, mostly people begin with a training manager role, but gradually they can evolve into full-time clinical data managers also. And there are multiple career options in public health management. One can there you can be a special epidemiologist, a research fellow, a monitoring and evaluation specialist, coordinators in health training, medical officers and project managers, biostatisticians, public health managers. So even within these 2 years, we encourage students to, although we teach very broadly, but there are some electives which are available to the students. So there are some students who have a bent for, say, data analysis, and many of them are doing a lot of working with huge data sets, for instance, from the pharma industry, data sets from public health. So it depends on your own interest also. If someone is more interested in behavior change communication, you can become an IEC, BCC specialist. Some want to be those, some have been employed as epidemiologists, which is a more standard job. But I'm telling you that there is a lot of options available when it comes to public health management. These are some of our previous employers, and our placement is quite good. It's usually at least 92%, even during COVID time when there were some problems. And the salary scale is mentioned for the previous batch. Sector-wise placements you can have so there is some of us are some of the students are placed in academic research institutes. A lot of them go into the development sector, the corporate sector. A few of them also want to do their PhDs or some other higher degree. We have an opportunity for scholarships, although these scholarships are announced after you join the course, and it totally depends on the sponsors, because every year we have a different level of sponsorship. So usually it is difficult to get complete scholarship, but a partial scholarship has been provided to nearly 1 in 4 of our candidates in MPH. MSc does not have scholarships at this moment. And how to apply? This is our website, phfi.org. You can go to click on the on-campus courses, and all it is still last date is till 30th June. So this is how we work, and this is our campus in IIPH Delhi, and our on-campus programs are available. As I told you, we have 5 centers across India: in Delhi, Gandhinagar, Hyderabad, Shillong, and Bhubaneswar. So these are our on-campus programs. We have a lot of e-learning, e-course. These are online programs, e-postgraduate programs. So these provide a online diploma, and we have certain certificate courses also, e-courses which run for 3 to 6 months. So for any further information, you can contact. So I'll be happy to take any questions you have now on public health, especially. Yeah. Stop sharing my screen. Yeah.
Thank you, Dr. Vasu. It was indeed, it was, I think, very helpful for the students, because even I'm talking about myself, I was also not aware that courses like these are running, where the students from dental and medical backgrounds and even the nursing background, they can enroll and they can make a career out of it.
Yeah.
So I would invite, questions are there from the students. You can put the questions in the chat box, or you can ask also directly.
Yeah, please go ahead. You can ask any question. It doesn't. Yeah.
Like you showed in your slide that the last date for admission was May 2020.
No, it has been extended to 30th June because this year. So still available. Yeah.
The students should note this, that the date has been extended to 30th June 2022, so they can still apply for this course, for the
Yeah.
various courses. So all the courses, for applying for all the courses you enlisted.
For the MPH and MSc course, because and the postgraduate diploma course, the last date will be 30th June. Yeah, and for other courses, they are available throughout the year because those online courses are available throughout the year. The 30th June is the deadline for the MPH, the Master in Public Health, the Master in Clinical Science, and the Postgraduate Diploma in Public Health.
Okay. I can see Naresh also with us now on the screen. Entrance test. There is entrance test also for these courses.
No, I can just share the 1 second. 1 second, please. So we don't have an entrance test as such, but there is a statement of purpose, the CV, and so the shortlisting is based on this. So
Okay.
1 second. Yeah, so we need the CV, the contact details of 3 referees, certificates and credentials, and a statement of purpose. And based on them, we shortlist the candidates. And after that, there is an interview. So that based on finally that interview, we select, we finally select the candidates for our programs. So there is no exam as such, but there is an interview after the shortlisting of candidates.
Students, any questions from you? No questions from students? I think, so one student has asked that, could you please explain the procedure for scholarship again?
Okay. So the procedure for scholarship is you don't actually need to do anything at the time because the scholarship is provided after you join the course. The opening call for scholarship comes after you join the course. Okay, it is not beforehand. You will come to know that whether you will get a scholarship. And the reason is that our scholarship depends on funding from the industry. So when we get, so we can't predict beforehand that how many scholarships we are going to have. And scholarships are only partially, we are able to provide usually only partial scholarships. So it is not, so you don't actually need to do anything right now. If you intend to apply for a scholarship, it will only happen after you have, joined the course. And then we have a call for scholarships, and the factors are your performance, your class performance, your need. So basically, we take into account socioeconomic status and some other factors, and based on that, the scholarship is provided. So at the time of admission or at the time of applying, you don't need to do anything. There is no separate procedure for applying for the scholarship.
Okay. So, I don't see any other question as yet. Can you tell something about the fee structure?
Yeah, Naresh is there actually. Naresh, would you? Anyway, it's to my knowledge, it's given in the site, but it's 1 lakh per semester. So there are 4 semesters, so it adds up similarly. And this is for the MPH course and the MSc courses. The postgraduate diploma is for 1 year, so it's half of that.
Okay. So, thank you so much, Dr. Saurav Basu, for being here and guiding our students. I'm sure they will benefit from it. And thank you, Naresh ji, also for making this lecture possible for the students. And now I invite Dr. Anita, our Vice Dean Quality and Assurance Cell. She will thank you formally now.
Thank you so much, Dr. Naresh and Dr. Swaga. It was actually we were also not knowing this much broad field of public health, having the avenues for our undergraduates. Many of the times we are thinking that community medicine is like very boring when the students go and opt for that. They think so many definitions and so on. And but if they know the avenues and the future perspective, and especially that we say that prevention is better than cure. So prevention and curative aspect of a country that matters.
Yes.
Then we are investing in the cure, in the terminal illnesses, building hospitals and so on, and investing on the prevention and the cure. I think that is a better investment, as you said, also in your. So I think, but we are not sensitized. That's why many of our youths, they are not stepping up in this. And maybe one of the reason is that they are not enlightened about this. So from my depth of my heart, I just want to say that thank you so much, and sparing your time. I know you people are very busy. Sparing your time and coming here and sharing all your aspects and avenues with us. Thank you so much. Thank you.
Thank you, ma'am, for providing this opportunity, and I always like discussing these aspects of public health with students. So it's more, that's why, of course, you are very right that because it's a medical university, so mostly students have some familiarity. Often we go to even universities which are not medically linked, so there the awareness of public health is even lower. But here we already have a subject in community medicine, so students have some pre-existing awareness. But yes, MPH is a good option. I'm not saying MPH just from IIPH, but from otherwise also. It's a very good opportunity if you want to continue with the other side, if you want to explore some non-clinical aspects. Because obviously, nursing, whether it is nursing, whether it is medicine, whether it is dental, you already have a clinical opportunity when you directly treat patients. But suppose you don't want to venture into that and want to look for an alternative career option, then public health really is can be quite rewarding and fulfilling. Means not rewarding, so I hope it's helpful. Thank you all for your. So thank you, and thank you, Dr. Redden, for this opportunity.
Just a second. We are presenting you an e-certificate. Just a moment. As our token of thanks from our side. We'll email it to you. Just a second. So
thank you. Thank you so much.
Thank you. Thank you.
Thank you.
Thank you all. Thank you all students, dear students. I think that you are now well aware of this opportunity in your career. In case you want to serve the nation in this capacity, this avenue is also open for you. Thank you. Thank you all.
Thank you.
Bye.